also strawberries. So hair loss isn't just a problem for men. It impacts more than 21 million American women, and by the age of 50 affects approximately 85% of men. There are many remedies, but our next guest says the most permanent solution is, in fact, hair transplantation. And Dr. Gregory Wiener, a board-certified plastic surgeon, is joining us today to talk about hair transplantation. Thanks for coming in. Good to see you
Thanks
again.
for having me, Sylvia.
When I think of hair transplants, I don't always necessarily think about, I think about men. I don't think about women.
Right. It's a big problem for women, too. 21 million women. I mean, it's something that is very common, unfortunately, and it happens to women typically around menopause, could happen a little earlier than that, and it's a kind of a uniform hair loss. Unlike men's hair loss, women's hair loss tends to be more uniform across the entire scalp, preserving the frontal hairline.
So as opposed to spots where we see sometimes in the back of men's heads and things like that. So, so as a result, hair transplantation is an option for both men and women.
Absolutely.
Okay, so there are different types of hair transplantation, right?
Right.
So, and you have informed us there are 3. So let's start with this follicular unit strip surgery. What is that?
Well, that's, that is still the most common kind of hair transplant procedure. And, basically what you're doing is you're harvesting a strip of skin and the hair follicles from the back of the head. The hairs in the back of the head are actually resistant to hair loss. They have a different genetic structure. So those hairs, when they're transplanted forward, they'll stay there.
Really?
Yeah.
Oh, that's interesting. I did not know that. And then scalp reduction method, what's that?
Well, if you'd had hair restoration done 50 years ago, that's what you would have had.
That's the old-fashioned one.
Yes, that's old-fashioned. That's moving hair-bearing areas from the back to the front with surgery. Doesn't look too good.
Okay, and then the next one, the one that you're here to talk mostly about today, is called Neograft. Is this the latest in hair transplantation, and what is it?
Right. Neograft is follicular unit extraction. So unlike the strip method, what we're doing is we're harvesting individual areas of 1 to 4 hairs with a little punch type thing. Yeah. So you don't have the long scar.
My first thought is, ouch. Okay, this sounds very painful, but we're looking at some before and afters here, and there's a significant difference. So for people who are watching and are interested, it sounds extremely painful, is it?
Well, I mean, it should be pretty painless once you're numbed up. And basically what you're doing is under local anesthesia, you're numbing the harvest area and you're numbing where the hairs are going. Okay,
and so what are you doing when it comes to neografting then, as far as you've kind of explained a little bit, but when all is said and done, what finally happens?
It's mainly in the harvest technique. The harvesting is easier, it's quicker, it's faster, it harvests a better grass. What you're doing is you're actually taking a little punch and punching out 1 to 4 hair units, and you're doing this hundreds of times, and it doesn't create the scar, and it's faster, and it provides better graft.
Wow. Okay, that sounds like a long procedure. Am I right? How long does this take?
Well, yeah, these things can be, anywhere from 3 to 4 hours, sometimes longer, depending on how many hairs you're transplanting.
Okay, so we're looking at these before and after. What's the average result people can expect?
I mean, typically, the one great thing about hair transplantation is it's pretty predictable if it's done by someone who does a lot of this. And so, you're going to get your 70–85% of these hairs that are transplanted should survive.
Wow, this latest one here looks absolutely fantastic. So how do you know when it's time to think about a hair transplant? Because there are different drugs, minoxidil, Propecia. Those aren't as effective, or what's your advice?
The problem with those things is they're not going to stop the process. They may slow the process a little bit, but it's not going to grow new hair.
Oh, it's not.
None of these are. And really, the hair transplant process doesn't provide new hair either. We're just taking hair from back here and going forward. Typically, I like a little older patient in the 40s because their hair loss is kind of stabilized out a little bit, and so you can make a better prediction.
Wow, so we're looking at a picture of before and after from a woman, and you can see there, right there, big difference. Do you think women are a little more reluctant to come to you to talk to you about this?
Absolutely. It's traditionally been a male-dominated patient population, but I think more women are actually becoming aware of the transplant issues.
And next question is, does insurance cover any of this?
Unfortunately, no.
No, it doesn't, huh?
Right.
So, and what does an average hair transplant cost?
Depending on how many hairs you're transplanting, somewhere between $5,000 and $10,000.
Okay, so, but for the people who have it done, what do they say to you after all is said and done?
I mean, people are happy because as I said, it's predictable. You're going to get results, and it works. It's a process that actually does work.
Okay, very interesting. I did not know that about the back hairs.
Yeah, that's why it works.
Very cool.
They're resistant.
Okay, oops. Very cool. Nice to see you again.
Good to see you too, Sylvia.
Very interesting. Thanks so much for the information. Always interesting when you come in.